This is Dr. Brent Wright on discussing how to have twins naturally. First of all, twins is a relatively uncommon situation in the United States. It occurs anywhere from about 12 to 15 per thousand in the United States. In some cultures, it may be much higher. Some areas in Latin America, Argentina, there are some places where, because they think diet may affect the increased risk of ovulating multiple eggs, that people may have more twins in those areas. The other modifiable risk factors are of course, you can't change it, your race, and where you live, the country you come from, the diets that you eat, and if somebody has had multiple children, they're increased their risk of having twins later on in life. After the age of 35 may be a modifiable risk factor. So some of these things can increase your risk of having twins. Of course, the most common one used in the United States is fertility drugs. Seeing your doctor, getting drugs such as Clomid, Pergonal can increase your risk of twins, but none of these are really natural mechanisms. These are all artificial or pharmaceutical derived methods, in vitro fertilization being the most common. But when you're talking about naturally occurring twins, it has a lot to do about culture, genetics, and things that aren't really modifiable. There is some evidence that perhaps phytoestrogens that you can find in certain drugs and foods such as yams may increase your risk of having twins. They have done a study where vegans who have no dietary dairy products in their diet have a decreased risk of having twins. So it may be some evidence that phytoestrogens may slightly increase your risk of twinning. So if you have any questions, please discuss this with your physician. Dr. Brent Wright, discussing how to have twins naturally.